Hi, my name is Dr. Alizadeh. I'm a board-certified plastic surgeon and professor of plastic surgery at New York Medical College. An area of my interest and passion recently has become hair transplantation, mostly because as a man who has had hair loss, I have noticed how I started losing hair as a young man. And by the time I was in middle age, it really became significant. And really within a few years, there was a dramatic change. The good news is that there's a number of medical interventions that have become available. And now we offer all of them at Cosmoplastic Surgery here in our offices. So what we like to do initially, especially with younger men or women that are noticing hair loss, to first diagnose and make sure there's no medical conditions that are responsible for this. These are things such as an immune-related disease that could cause hair loss. It could be a hormonal mechanism, such as thyroid conditions that can cause hair loss. So once we can rule that out, we can move on to other things that can help benefit, not only with regards to maintaining the follicular growth, but also helping stimulate it. These are things such as hair drops that have medications in them. And now we're able to formulate these medications in our proprietary fashion, where we have as much as 4 or 5 drugs into a very simple drop that you use on a daily basis. That allows you to see some of the changes with your hair growth pattern. And if that's not enough, then we move on to using PRF, which is a technology that uses your own blood, processes the blood to get essentially the stem cells or the cells that help stimulate the growth, and we inject that into the hair follicles to help see a faster growth. Both of these techniques, you really have to maintain it. They're not a one-time where you're doing the procedure and then you're one and done. So you really have to be able to maintain it. And it's much better for the younger population where they're starting to see some loss, but they haven't completely lost their hair. Once you get to a stage where you see complete loss of your hair follicles, and there's a genetic predisposition where you see your parents or near relatives have already lost their hair in the same pattern, then we really want to think about hair transplantation. And the exciting technology that we have here is an automated follicular unit extraction technique, which is very unique to what we do. I was so excited about this technology that I became a patient myself, and having undergone the procedure, I can tell you it's very easy, minimal discomfort. There's virtually no pain during the procedure. We just give you some sedation. You're awake. You actually have lunch during the day. You go ahead with the removal of the grafts, preparation of the grafts, and then preparing the recipient site, which for a lot of people either ends up being in the top of the scalp or even in the hairline. And once that's prepared, then we're able to strategically put the follicles in place in a way that makes sense for your hair pattern. And once that happens, then you have about 2 days of downtime where there's some swelling. We try to control the swelling through our techniques that we've learned. And really within a week, there's really no actual signs or symptoms that you've had it. We usually tell people to give yourself about 2 weeks just to be sure. And then after 2 weeks, there's really as if you've not had the procedure. However, the hair follicles go into a state of rest, and they're in that resting phase for a few months. And so you may not actually see hair growth again for a few months, which can actually last up to 9 months. And then after that 9-month period, you start seeing that full head of hair in a way that you would wish. Now, the technique, what's interesting about it is that the area that will remove the hair follicles allows it to sort of hide and camouflage in a way that it's a very random pattern. So there's no one area that you see it. Unlike the old system, which you've heard about, where they used to take a strip of hair and people would really see the scars, and it would be a very typical pattern that you would see. So this is a completely hidden, no scar technique with a minimal downtime. And I highly recommend that you read up on it and educate yourself, because we've seen incredible results. The NeoGraft technique allows us to perform a scarless technique by individually removing follicular unit extraction. Follicular units are basically groups of hair follicles that tend to live together and group together. And these could be groups of anywhere from 2 to 4 hair follicles that are in a random pattern throughout your scalp. So understanding how to do that, and our techs and our team are experts, having done over 5 million grafts in the past 20 years. That's very important to have a great outcome where it looks extremely natural. So you were able to take these grafts, process them, and then strategically place them in order to replace your own hair pattern. And the way we learn about your hair pattern is by looking at some of the photos before the hair loss happened. So we see how the hair came together at the front of the hair as well as the back of the hair. This is all done in one day. So you come in, we give you some sedation. You're awake, but you're completely sort of numb in the area and totally sedated and comfortable, listening to music, sleeping throughout the procedure, to the point that, having done it as a patient, literally the next thing I asked was, are we done yet, or have we started yet? And they told me the procedure is completely done. Depending on the number of grafts that we do, the procedure can take anywhere from 5 to 8 hours. And again, you're able to go home, have dinner, and you usually have a period of swelling that lasts anywhere from 3 to 5 days. Most of our patients by 1 week are feeling that they can get back into the regular visual contact. You can certainly get back to your work by the day after surgery. And then if you really have a commitment where you're in front of a camera, you're at a wedding or a significant event, we'd ask you to wait anywhere from 2 to 3 weeks where things really return back to normal. The hair follicle reaches its ultimate growth pattern by anywhere from 6 to 9 months, where you can have that full head of hair and looking very natural, where you can swim, you can do sports, you can pull on the hair. It really acts like your own hair after that period of time. So I really encourage you to please learn about this. Go on our website, understanding, and ask any questions that you have, because it really has been one of the most gratifying things that we do. And I can speak to it not only as a surgeon and as a doctor who teaches this, but as a patient as well.